Welcome to modeling potential health gains and health system savings associated with vaporized nicotine products in Canada. My name is Pierre-Emmanuel Paradis and my co-author is Christina Rucho. The objective of this study was to model the population-wide health and cost impact of vaporized nicotine products, or VNPs, for the Canadian adult population from the years 2015 to 2095. To do so, we use a multi-state life table model called the APICO model that we developed that uses different data sources on demographics and disease, smoking vaping prevalence by state, and risk ratios of disease incidence by state to project the different outcomes in terms of disease incidence, disease prevalence, number of deaths, and cost outcomes. All the data sources are publicly available, so from Statistics Canada, Public Health Agency of Canada, and Canadian Institute for Health Information. The study population was separated into 68 cohorts by age in 5-year age groups, sex, and ethnicity. The 6 different states considered were current smoker and not current vapor, dual user, never smoker and not current vapor, former smoker, either current vapor or not, and never smoker and current vapor. The different transitions from one state to another could happen yearly, and the probabilities were based on a literature review, as was the relative risk of contracting a tobacco-related disease, also based on the scientific literature. The outcomes that were observed were the incremental social cost associated with each year of life years lost or gained, the cumulative disease cost over a simulation time frame, and the cumulative mortality cost over the entire time frame. The 3 scenarios projected were the status quo scenario, so essentially the current situation in Canada, the no vaping scenario, where assuming that no VNPs ever entered the Canadian market, and a pro-switching policy scenario that, on the contrary, would encourage an increased prevalence of VNPs, which could result from changes in the regulatory or policy environment. The results of this study are the following. So the status quo, so allowing VNPs on the market, will result in a projected 500,000 lives years gained, so not lost because of tobacco. And the overall benefit from the status quo scenario is $39 billion, essentially most of it from the social cost of life years not lost due to smoking-related diseases, but also a sizable $2.1 billion of disease cost and mortality costs saved. The pro-switching policy would increase by another more than 700,000 life years gained, resulting from more adoption of VNPs and additional economic benefits of $30.4 billion. The study also presents some breakdowns of these net economic benefits into men, women, non-Indigenous, Indigenous, and also in terms of the social cost or value of life years and of health cost. The sensitivity analysis also confirmed that even varying the different risk ratios, the results are consistent, as is the case when we run through a Monte Carlo simulations for the disease risk ratios. In both scenarios, all the confidence intervals show that our results are statistically significant. So in conclusion, an increased accessibility of VNPs for adult smokers who seek an alternative to combustible cigarettes in Canada may generate significant public health gains and health system cost savings. Thank you very much.